My name is Nicole Kaplan, and I am the nurse coordinator here at Lancaster Maternal Fetal Medicine.
Wonderful. And how long have you been working at LMFM?
I have been here for 5 years.
Wow, that's great.
Yeah.
Well, the reason we're here today really is to talk about a really important event that is coming up this April, and it's Sexual Assault Awareness Month. And I wondered if you could just explain a little bit about what Sexual Assault Awareness Month is and why is it needed?
Sexual Assault Awareness Month is to raise public awareness that this is an issue, and it also gives the opportunity to educate the community so that they can actually help to prevent it and help those who have survived it. When I was a labor and delivery nurse, I actually noticed that people who do have a history of sexual assault do labor differently. And I took my observations, I researched it, and then I took all this knowledge that I learned from the research and was able to then teach people how to care for women who have had this experience. So I brought that knowledge here, to Lancaster Maternal Fetal Medicine. So we see it in pregnancy, we see it in labor and delivery, from anything of a sense of a loss of control. Their bodies are changing, their breasts are getting bigger. Sometimes just breast leaking can be a trigger for some women. In labor, things like losing control because you're in pain, because you're being told what position to be in, because you need an IV. So there's so many different things that can happen during pregnancy and labor and delivery that can be very triggering for some women. Some women may not even know that they are going to be triggered until it actually happens.
So it must be important that you know about a person's history of any kind of sexual assault.
Or at least treat everybody as if they've had a shared experience, because then you just assume that everybody's had this experience and you treat them all the same.
That makes a lot of sense. So what are some ways that, if you were training providers to help people who have experienced a sexual assault, how could you help them understand how to make patients feel safe in this space?
Even here, just in the OB office in Lancaster Maternal Fetal Medicine, we do ultrasounds on everybody. So giving patients choices, not requiring every single person to have a transvaginal ultrasound. But if we really recommend it, why are we recommending it? So patients should know why we're doing what we are doing. If they are struggling with a transvaginal ultrasound, I can be there to help them talk through it. We can, if somebody needs to face a certain direction, or if we can offer them to actually insert the probe themselves. So something to give them a sense of control. But they have to know why we are doing what we are doing. So providers explaining that, so that there's no doubt as to, was this really necessary, or do we really have to do this? They understand why it's recommended, and then if they can't do it, they can't do it. That's okay. So we have to give them choices.
Great. And following up on that, what are some common feelings that a survivor might experience in the office, or even in labor or after having the baby?
Really, one of the most significant ones is a sense of loss of control. So you might see some women with a history of sexual assault have the most explicit plan for her labor. And that's a way of her to maintain some kind of control. So it might, instead of a birth plan that's a page long, they might have a 10-page birth plan. And that is very common because they just need to check off all the boxes that they are in control.
Sure.
Yeah.
So who could help them with something like that, a birth plan?
So they can talk to their OB office, who should be able to help them with birth plans. They can look at them online. And talk to the OB nurses, talk to the OB providers. Yeah.
Great. So how can, if, just a healthcare provider that's watching this video and has started to think about this, hopefully not for the first time,
Mhm.
but maybe it hasn't been in the front of their minds until recently, what can somebody like that do to help a survivor?
So there are books that they can research. They can call me. I'd be happy to help talk somebody through this. Um, lactation consultants can reach out. There is more information out there now than there ever has been. When I started doing this about 20 years ago almost, there was not a lot of information out there, so it was a lot more difficult to find information on how I can help people. But there's so much more stuff out there now. Yeah.
That's great. What about just the average person who's not a healthcare provider? What can they do to either help support a friend that may have gone through this, or, just in general kind of help with, Sexual Assault Awareness Month?
I think volunteering, first of all, for the National Sexual Violence resources. They can, to be supportive for a friend, I think the best thing somebody can do is believe your friend. So, and that's a huge thing with most survivors, is they don't feel like they would have been believed, or they have been believed. Who would believe this story, so just even believing the story, and then you don't even have to find the right words, because sometimes it can just be very uncomfortable. I think just being present is huge.
And you work for Lancaster Maternal Fetal Medicine, which is obviously it's a high risk obstetrics practice. What does support for a survivor look like at Lancaster Maternal Fetal Medicine?
So treating everybody with respect, believing our patients, making adjustments with what we do if it's going to help the patient, the survivor. We make accommodations. So for some people, they can't be in a closed room. They can't have the door closed. So we can leave a door open and pull curtains. So there are definitely things that we do. Even during our non-stress tests, just explaining every single step that we're doing, because we are strapping the monitors around them. So, just explaining everything that we're doing.
Great. So thank you so much for being here.
Yeah.
Do you have anything else that you'd like to the people out there know
I
about?
think it's really important to know that survivors can experience trauma in so many different ways. No two people are going to experience the same. Some people may never have flashbacks. Some people may just be totally fine in pregnancy, delivery, and then all of a sudden have be struggling with breastfeeding. So just an example with the breastfeeding thing, some women will feel like they're forcing their breast into their child's mouth and feel like that's a form of abuse. And of course it's not, some women will, if their abuse maybe occurred at night, they can only breastfeed during the day, and they cannot breastfeed at night. So there's just so many different things that it affects. So, some women might do fine during pregnancy and have a horrible labor experience. We also don't know always who the abuser was. So if a woman is laboring and the abuser is actually in the room, that can affect her whole labor. So her labor may completely stall. Deer do that. So when deer are in labor in the woods and then they feel threatened, their labor just stops. Yeah.
Well, thank you so much for being here today and talking about this really, really important subject and helping people bring awareness to it. And we'll put some contact details for you in the post. And if people have questions, they can reach out. Yeah?
Sounds perfect.
Wonderful. Thank you so much,
All
Nicole.
right. You're welcome.